I'm Krishna Karpe, one of the kidney physicians in Canberra, and we'll talk about dialysis. Kidneys remove waste products from blood and also maintains fluid and electrolyte balance. Dialysis is required if kidneys are no longer able to do their job effectively. And there are two main types of dialysis. Hemodialysis, where blood is circulated through a dialysis machine which filters waste from blood before pumping it back to the body through a tube connecting the individual to the machine. To deliver blood into the filter, an access is created into the blood vessels. The preparation for dialysis starts a few months before dialysis, unless it's an emergency. The access created is called an AV fistula, which is usually in the arm and takes about 12 weeks for it to be ready for use. If the dialysis is required as an emergency, a catheter is placed into a large vein. Hemodialysis is usually done 3 times a week, approximately for 4-hour sessions. Or if it's done at home, then it could be done almost every day of the week, depending on personal preference and the dose of dialysis which is required. In-center hemodialysis offers a social setting for the patients to interact with others on dialysis. And also there's support from the dialysis nurses in their treatment. But it may be quite inflexible in terms of time selections. It may also lead to fluctuations in blood pressure, and there could be muscle cramps at the end of dialysis sessions. Coming to the next form of dialysis, which is PD or peritoneal dialysis. Here, a specially formulated fluid called dialysate is pumped into the abdominal wall. The abdominal wall acts as a filter, and waste and excess fluid is drawn from the blood vessels in the abdomen, which then the fluid is drained out in cycles. Peritoneal dialysis could either be performed manually, which is called CAPD or continuous ambulatory peritoneal dialysis, or by a machine, which is called APD or automated peritoneal dialysis. CAPD does not involve a machine. Fluid is infused by the patient into the abdomen, and then they go about their normal activities. And then the fluid is then drained out into a plastic bag. In automated PD or APD, a cycler machine delivers fluid at night and also drains out this at the end of the night. There are several advantages of PD. It offers flexibility in terms of lifestyle. However, there are also complications associated with PD, such as infections of the abdominal wall called peritonitis. There could be absorption of glucose causing metabolic disturbances. However, dialysis does offer flexibility in terms of selection, either hemodialysis or peritoneal dialysis, depending on the patient preference and also their ability to do these or sustain these treatments. In summary, hemodialysis and peritoneal dialysis are the two types of dialysis. The modality of treatment is dependent on patient preference and also the feasibility of doing such treatment. They're complementary treatments, and patient could transition if one type does not suit the other. Thank you.